It is emerging that the country is exposed to the coronavirus more than the government would like to admit. Various sources who are in direct contact with the situation at the Jomo Kenyatta International Airport and whose versions of the situation are independently aligned say they are not trained to handle the situation, do not have the proper protective gear, lack the number of effectively handling the situation, and add that the staff at the airport are living and working in fear for their own lives. Helen Aura gives us the details as shared by one of the staff members at JKIA.
The reality of 239 passengers on board Southern China Airlines plane disembarking at the Jomo Kenyatta International Airport on the morning of 26 February 2020 has not only raised concerns but brought to the fore the risk Kenya is exposed to. This comes right from the preparedness or lack of it thereof of the personnel on the ground.
The level of preparedness at JKIA is wanting. This is because one can't really say there is much in place, even for the grooming companies, the person who drives the cargo and the person who ferries the passengers in the buses. The only thing you can say they are provided for are the masks and the latex gloves.
The government says that over 600 personnel have been deployed to attend to the screening, but sources indicate that they are actually about 60 on the ground. They are comprised of only one medical doctor, nurses, clinical officers, and public health officers. The lead on such a situation should be infectious diseases specialists, but there are none in the JKIA team, which is sagging under the weight of understaffing. There are more gates than officials, leaving them very thin and less efficient. With each shift having about 12 people at work, there are lapses where some people gain entry without being screened, and some staff, such as cleaners and helpers of persons with disabilities, access planes without the relevant gear and get back into the airport. It gets worse.
In terms of disaster and epidemic training and drills, we are at zero. We have not been trained for the situation.
This video taken at the airport shows how the screening process is conducted upon arrival at the Jomo Kenyatta International Airport. An official is seen hurriedly screening passengers. The National Youth Service officials are also at hand to aid in crowd control. They are all masked. But there is a problem. They are all in surgical masks, which do not shield them from getting infected. The ideal masks are called N95 masks or respirators, which are ideal for this case. Sources indicate that there are some in store but are not being issued to everyone. The masks are being issued to staff who are asked to reuse them for about a week, yet they should be discarded after use. In regards to equipment, there are 2 thermal scanners, one of which is not working. There are only 6 thermal guns expected to be used to screen the thousands of travelers, and they are not always at hand to deliver.
We had a case where the thermometers failed to work. They overheated. So even what the health ministry is purporting that they were screened and they were okay to mingle with the people in the societies, the passengers, is just a hoax.
One of the ways of steering clear of the virus is washing of hands and general hygiene. At JKIA, water is switched off at midnight and back on at about 4 a.m. This leaves even toilets without running water to flush or wash hands, facilities that are shared by travelers and staff alike. NTV has been seeking access to the airport to film the screening process for weeks, but keeps getting ping-ponged to different offices, none of which has granted access. The details in this report, which is not exhaustive of the situation and exposure, may just explain why. Helen Aura, NTV.
Rose, as you've been watching?
Oh, very frightening. Very frightening. I mean, I think... I think we really need to reach a stage where we're not, I think Henry said earlier, let's not be afraid of our weaknesses, because when we discuss it, when we dialogue, when we bring it to the fore, you can begin to engage with issues and, you know, put in place counters to it, you know. But we have a history of always running to the defensive, always being on the defensive about any illness breaking out, and it's not something that started today, you know. I mean, go back to any outbreak, HIV/AIDS, talk about Ebola, talk about everything. Every time we have an outbreak of disease, Kenya's position tends to be defensive. you know. And I think it would be useful for media really to engage on this one, because whatever we can push in terms of getting infrastructure and getting movement and getting, you know, public communication flowing will serve for the future as well. Let's get out of this defensive mode. It doesn't help anybody.
Always on the defense. David?
Number one, kudos to NTV for getting the story out.
Yes.
I started by saying you have a single duty. Seek the truth and report it. Cause no harm. I know that the video was not easily acquired. The interview is not easily acquired. That's exactly the role of the media, that we have a big pandemic across the globe. We can't get information, but because we have established media houses, we seek and bring the facts. What we need to see now is, and that's a problem, unfortunately, of the government, is maybe they'll talk about, no, water is never switched off. You know, some of the facts that were saying, no, we have more than 2 machines and all that. Then you wonder why if questions have been sent to them, why did these answers never come? But when the media goes out of its way to bring such facts to public, because you can imagine if we had the virus in this country, how many people would be affected. Basically, every corner of this country would be touched. Right. And if we don't have enough masks in Nairobi. I saw on the BBC documentary yesterday that a few people in Nairobi were preparing to export masks back to China because there's a high market there. So the whole idea is yes, it was on BBC yesterday. Yeah. So the whole idea that the media has gone out of its way, despite being denied, to simply bring and say there is a crisis happening and you have a duty to protect Kenya. And I think for me, that is kudos to the media.
Henry, when someone speaks to us in confidence like this, at least to bring out the truth, and we have many who would still want to talk to us, just to tell the country we are in a mess, how do we ensure we protect them as media? They're talking to us.
I think there are 2 or 3 things that need to be done. One is internally, before a reporter is out onto such a process, there must be a protocol on protection of sources. And it must be discussed, because once you've tried once or twice and you notice that there is a barricade, you're going into a process that could cause harm to the person who's volunteering as much information. So I want to believe that internally there is a safety protocol for sources. And 2, that once you've done the story, you will go back to that source with a view to offer them any other support that may be required.
If they're fired?
If they are fired, then you need to be able to help them litigate because they went out of their way to offer you information that has helped you to remain who you are. Yes. So that's why I'm speaking about a sources protocol. So you begin to know that there are people who would give you information in confidence, and that enhances your credibility. It enhances your sales, but they could be predisposed to harm. And you have a duty not to let them fall into the harm unmitigated. Right. So a question could be that you want to pull it back to Airports Authority, you want to pull it back into civil aviation to say how many staff are you punishing because of giving information when you didn't. And that becomes another story you must sustain. Yes. To be able to protect those people. Number 3 is to liaise and work with other people who can protect those as critical sources of information, because you could even speak to Parliament, because this is a big question. How prepared we are is a national sovereignty issue, is a national security issue, because a country can be wiped out by this disease. It's not a joke. So if we need certain people protected, then we need even Parliament to step in. Remember, we are speaking of this. The first doctor who captured this virus ended up dying. Yes. And that's what secrecy can do. That if China had dealt with that doctor differently and took the information he was sharing as a warning that this thing could get out of hand, perhaps he would not have died. Perhaps we would not have had as many people. So secrecy in certain situations does not help. And I think that's what Rose is reiterating. There are times when secrecy helps, and there are times when secrecy doesn't help. And I began by pointing out the Guinea, Liberia, Sierra Leone kind of situation. 3 countries affected by same pandemic one nearly annihilated, others a bit more stable and losing fewer people because they dealt with the information differently. If the ministry does not have enough health communicators, then there are experts in this country that are helping other countries. I know of health communication experts who are there for Liberia, who are there with mobile phone companies to help in mapping information so that you didn't need people to go there physically, but using call logs, they were able to even trace where people are. We could have done that with our students in Wuhan to get to know to specific locations where they are and information being picked for purposes of offering logistics. So this is not strange. Kenyans are helping all over the world to do this, but we seem like we are totally lost. We don't know what to do. And this is not for lack of experts.
In dealing with the students and getting information from, there has been the fear that perhaps some of them who are under scholarships in Wuhan would lose them if they were to say something that would go against, you know,
and that's why you don't need to talk to the student.
Yes.
A mobile phone triangulation process, for them to just send a message, would tell you, we have 200 in this situation. I've been under quarantine for how long? I'm well, but the other person is unwell. This is the number we are. I'm on scholarship, but can I be able to defer? Because there is no learning going on. So you need to survive first to secure the scholarship. Otherwise, you secure the scholarship in death. It's not helpful.
We are talking about the government being prepared for this, and not to sound alarmist or sensational, but in the event that this actually breaks out and there happens to be a case here in Kenya, for the safety of journalists, first of all, are we even prepared in covering this particular issue?
You will notice when the plane landed, the China plane landed, we had other, I think a few foreign, either journalists or other people, agents there, and they had masks and a few protective clothing on. The Kenyan guys there were just generally there in that video of the Chinese plane landing. So it's about the way you say, we have a shootout down at Dusit, we have a bulletproof and all that. When you send people to cover this, have you bought the protective clothing? Because protective clothing is not just about helmets and bulletproofs. It's these, the gloves and all that. So it's a whole an idea of preparedness in the broadest. Now we're trying to prevent the virus and all that. Make sure that the journalists are prepared, because they will be required to go to the places and provide information. Number two, I've seen other countries now already telling people what to do. In case you were near this, they have people have been told to stop handshakes, don't get 2 meters close to someone, don't get close to someone, that it does not matter and all that. I think we need to engage a lot in teaching even the media, because in case this happens, and I'm not sure we are going to escape, because if Kenya is being ranked as the 13 most probable countries by WHO, well, I'm not wishing, but we will be. We should be by now be looking at what we call scenario building.
Yes.
Because in all other crises, people already go to scenario building, scenario 1, scenario 2, and scenario 3. You do this in this media house all the time when you have big news coming. I would anticipate that credible media house will already be at scenario building level.
But have you heard of that happening? So at least it's not happening here.
Well, I haven't heard about it. So what I'm saying is that of course, I'm happy that it is the headlines across tomorrow.
Yes.
Number one, at least we don't have politics. Number two, therefore, that we have, because for anything to qualify to headline, it means that it's a big matter, isn't it?
Yes.
So number two, therefore, is that how are we prepared to cover that?
Okay.
And that now calls for, because whenever we have elections coming, or the referendum, or a big event in town, the president is visiting, you do scenario 1, 2, 3.
Yes.
So now that you have put it, it has qualified to be the headline. I think naturally it should qualify into scenario building, preparedness, and all that.
Okay. And I want to
Yes.
insist that information is the first stop.
Yes.
It's not just information for journalists. Every single Kenyan should know. Every citizen should know and be aware and be reminded. It should be in schools, it should be in teaching institutions. It should not, by the time a journalist is going to cover a story, this should be deeply ingrained in them as a Kenyan. Forget about as a journalist. As a Kenyan, everybody knows that this is what I must do, this is what I'm going to face. And that's why, again, I think public communication, public health communication, it is our defense. It is the medicine that we need right now.